Follow me, because by the end of this video, you'll wonder how you spent all this time without knowing this important information. How I use aspirin to unclog arteries. Don't ignore. There's a tiny pill sitting in your medicine cabinet right now that could literally be the key to a longer, healthier life. But are you using it the right way? Aspirin has been around for over a century, and while most people think of it as a simple pain reliever, its real magic lies in its ability to keep your arteries clean and your heart pumping strong. But before you rush to pop a pill, let's break down the science, the risks, and the myths surrounding aspirin's role in heart health. Aspirin works by thinning the blood, reducing the risk of clots that can lead to heart attacks and strokes. In fact, studies show that daily low-dose aspirin can lower the risk of a heart attack by up to 25%. But here's the catch: it's not for everyone. The American Heart Association warns that aspirin therapy should be used only for those at high risk or with a history of cardiovascular disease. Popping it without proper guidance can lead to serious issues like stomach ulcers and internal bleeding. So who should actually be taking aspirin for heart health? If you've already had a heart attack or stroke, your doctor may recommend it as a preventative measure. But if you're healthy and just looking for an easy way to keep your arteries clear, there are safer and more effective options. Diet and lifestyle changes play a massive role in arterial health. For example, research has found that eating a Mediterranean diet rich in healthy fats can reduce heart disease risk by 30%. Regular exercise, quitting smoking, and managing stress are just as important as any pill you could take. But let's address a big myth. Can aspirin actually clear out plaque from your arteries? The short answer is no. Once plaque builds up, it doesn't just dissolve. Aspirin helps prevent new clots from forming. But if you want to actively reduce plaque, you'll need to focus on long-term changes like improving your diet, lowering bad cholesterol, and keeping your blood pressure in check. Now, let's talk about side effects. While aspirin is widely used, it's not without risks. Long-term use can lead to gastrointestinal bleeding, kidney issues, and even increased risk of hemorrhagic stroke in some people. That's why it's crucial to talk to your doctor before starting a daily aspirin regimen. Aspirin is not a substitute for a healthy lifestyle, and it should never be taken without medical advice. Even though its benefits are well documented, its risks make it a double-edged sword. What works for one person might be harmful to another. So, before you decide to incorporate aspirin into your daily routine, consult your physician and consider alternative ways to boost your heart health. Alternatively, natural remedies like omega-3 fatty acids from fish oil, flax seeds, and walnuts have been shown to improve heart health and reduce inflammation. Increasing fiber intake through whole grains, fruits, and vegetables can also aid in maintaining clear arteries. Garlic, known for its powerful anti-inflammatory properties, has been linked to improved circulation and reduced plaque buildup. Another important factor to consider is hydration. Drinking enough water throughout the day helps maintain optimal blood viscosity, reducing the chances of clot formation. Dehydration, on the other hand, can thicken the blood, increasing the risk of cardiovascular complications. Furthermore, ensuring adequate sleep is a game changer for heart health. Research suggests that people who consistently get less than 6 hours of sleep per night are at a higher risk of developing heart disease. Sleep deprivation leads to increased inflammation, high blood pressure, and insulin resistance, all of which contribute to poor heart health. Another crucial element is stress management. Chronic stress elevates cortisol levels, which can lead to higher blood pressure, inflammation, and an increased risk of cardiovascular diseases. Engaging in mindfulness techniques, meditation, or simply taking time for hobbies can significantly improve heart health. Moreover, regular checkups with a healthcare professional can be life-saving. Routine blood tests, blood pressure monitoring, and heart screenings can catch potential issues early before they become serious. Knowing your cholesterol levels and understanding your heart disease risk can help you make better lifestyle choices. So what's the takeaway? Aspirin can be a powerful tool for certain people, but it's not a magic bullet. If you're looking for a way to keep your arteries clean, start with what's on your plate and how often you move your body. And if you've been prescribed Aspirin, take it exactly as directed and be aware of potential side effects. If you found this information useful, don't forget to like this video and subscribe.